With some of the input of the peers that I meet at NRHA meetings, the folks who are doing the same kinds of things in other areas of the country, I think I've really been able to improve what I do and how I approach the problems that I have to deal with.
The research that we do, the evaluation work that we do, is informed by the NRHA members, and we partner with not only the members but NRHA itself very frequently, and having those connections I think really helps to inform our work and keep it grounded.
Rural has a quiet voice. We're a big area with a small population, and so having an organization that really brings so many different aspects together makes us actually a voice that can be heard.
Well, to me it means an opportunity to network with other rural organizations, not only in your state, but also across the country.
We have other kinds of organizations that are equally valuable, but this one is one that creates an umbrella over all of those other groups.
There's a group of people from all over the country that I have an opportunity to work with to make sure I'm doing things well and thinking through things correctly, that I'm not in isolation of other thoughts about rural health and how to provide it and make sure people have access to quality health care.
Well, it means a lot to me. I look at NRHA for education. I look to NRHA for fellowship, for networking. It's been an integral part of doing my job in the rural area for many years.
NRHA provides a great platform for discussing a broad range of health issues that are not specific to either conditions or particular aspects of the healthcare system, but they address all aspects of rural health, which I think is a really critical perspective.
You know, you get to establish those relationships that can help you to develop projects later on, or you may have a project that you're not quite sure where you want to go with it, and you could talk to somebody here and they could give you an idea and things like that. So just a great networking opportunity.
Understanding what rural communities are facing with healthcare reform, with budget cuts, a lot of the severe community issues that are going around the country in a very tough economic environment. Staying connected to people who serve those communities, I think, has really been important to our work, and NRHA provides that opportunity for us.
It's the only ones where you can get groups that represent providers, consumers, hospitals, AHECs, other organizations that are involved in rural health, all coming together with a relatively cogent and single mission to improve rural health care.